Hogan, and welcome to the Chakra House of Healing. Today I have the honor and privilege of having Dr. Oksana Sawiak with us today. And you're a wellness consultant, but you are more than that.
My background is dentistry.
Right.
For 42 years I was a dentist, and 30 of those was holistic dentistry. And so I took a lot of interest in things of health and, of course, how dentistry affected it. And when I retired from dentistry, I got my Doctor of Integrative Medicine and trying to integrate everything into helping people get healthier.
So holistic dentistry, that's a new term, I think, for a lot of people.
Holistic dentistry is not recognized by the licensing bodies as being any other different kind of dentistry. Maybe that's true because every dentist is holistic in the sense that they do affect the whole body.
Right, okay.
But not many of them are aware of that. The dentistry has, unfortunately, veered away from being a health profession into being tooth carpentry. And what I am finding is that more and more dentists will do a root canal preventively, or will cut down a tooth that is totally alive and well for cosmetic reasons.
Okay.
Or they will do orthodontics on a child by extracting teeth and just collapsing their whole bite. Those are the kinds of things that I get upset about because it does affect the whole body. And when they clean teeth, for instance, without checking whether the gums are infected and push everything that's in there right into the bloodstream, that, of course, affects every organ in the body that the blood supplies.
Because when you think about your teeth, you just want them to be white and shiny and not full of cavities and stuff. So you're not thinking about, well, they're doing this, and what is that really doing to the whole body? My teeth look great, so yes. Everything must be okay.
And we are very much in the era of cosmetics.
Right.
A smile is an absolutely necessary component of our wardrobe.
Right.
And also absolutely necessary for success in our lives. So if you don't have a smile that you can confidently smile with, your whole life is going to be affected. Right. Your career might be affected. Your relationships might be affected.
So when you were mentioning the gums. So let's talk about the gums a little bit.
Okay. If the gums are infected,
right,
and in 87% of North Americans, they are.
Right.
It is the most common infection in the world. Then when they are infected and you manipulate them with cleaning them with a scaler or an ultrasonic scaler even, what you're doing is you're pushing whatever infection is in those gums right into the bloodstream. And there are many problems that will entail because, for instance, Alzheimer's has been found to be partially caused by a spirochete that is found in gum disease.
Oh.
Another thing, many people get what is called acute bacterial endocarditis and end up having to have a heart valve replaced. Many doctors in Europe will ask you right off the bat, did you have your teeth cleaned when they see this? Because the bacteria that are in the gums, the parasites or the fungi, do circulate in the blood. And if you have a heart valve that maybe is a little scarred or maybe has had some toxins on it, or maybe you've been born with a valve that doesn't work well, those bacteria, viruses, or fungi or parasites will settle out on that valve, eventually infect it so badly that the valve has to be replaced.
So now everybody's probably, as you say this, I'm thinking like, I have been fortunate in my life that I've never had a cavity, not even in my baby teeth, but I've had issues with my gums. And because my gums are so sensitive, when I go in, they always freeze me like crazy. Okay. You know, one side and then the other side because they can't do it all at once.
So that's a symptom of either a bite that is that's interfering, or there is a low-grade infection there.
And the weird thing is, since I used to go for my cleanings once every 3 months, and now I don't go anymore. I made myself after one of your talks, I went home and I made myself my own toothpaste. And it was with coconut oil, baking soda, an organic baking soda, and I put in several essential oils like cypress, tea tree oil, a few different things like that. And ever since I've been brushing my teeth with just that, I have no sensitivity. My teeth feel great. I barely have to floss because the coconut oil like takes everything out of everywhere. And my mouth feels good.
One of the problems in today's society is that we are sold a bill of goods with the advertising. And the toothpaste companies really don't put all the ingredients on. There was a lecture that I attended in the 70s by Dr. Bhaskar, who was the dental surgeon general of the U.S. Army. And he said, "Do you know what's in your toothpastes?" And he said, because somebody asked me that, and I said, it should be fine, right? So when that question came up, he put the 10 top brands of toothpaste into the pouches of 10 of his, in the morning, when he came back, 8 were dead and 2 were very sick. And that's when he started looking at what is in toothpaste. We know now that fluoride does not help to prevent decay, but it does cause severe toxicity to our body, especially to our thyroid. And there are a lot of products in there, like sodium lauryl sulfate and propylene glycol and all these other things that have no place going into our body. They cause cancer, they cause toxicity, our livers get fatty, and we're putting a whole ribbon of the stuff on our toothpaste.
At least twice a day.
And toothbrush, yeah, twice a day. And children are exposed to this amount of toxicity. And I keep telling, do not give children any toothpaste until they learn to spit out. And they don't learn that until about the age of 5 or 6. So those are the kinds of things that I really get passionate about.
So you have this great thing about mental and dental, and how they how they coincide. So mental versus dental.
I lectured at the Ontario Association of Naturopaths last year, and they were quite amazed. Dentistry uses a lot of metals, for instance. One of them is amalgams, which are half mercury. If we had as much mercury as is in the air of the average dental office, in any other industry, the industry would be shut down.
Really?
This is because dentistry still uses mercury amalgams in the mouth.
And that's in the fillings?
That's in the fillings. You don't have any.
No.
Thankfully. But the average person does. Our parents had mouthfuls of them. The mercury that's given off a filling as you're chewing, as you drink hot coffee, is very significant. This is one of the things that will cause Alzheimer's, Parkinson's, dementia, memory problems, stuttering, shakes, and chronic fatigue. So one filling might not do it, but a mouthful will.
Now, there was something else that you said during that discussion that I was at, and that sometimes a dentist will use a certain type of metal in your mouth, to say in one of your fillings or something, and then in another one they'll use another kind of dental metal, and then you referred back to batteries.
Yes, when a tooth breaks down too much, you end up with a crown. And most crowns are based on a metal and then covered with a porcelain.
All right.
The metal used to be gold and platinum. Now gold is very expensive, platinum is expensive, so they put other metals in. One of them is palladium, which is very toxic to the body. But it is a soup of metals that is in that crown. And when you think about your high school physics, when you put two dissimilar metals together, that creates a battery. When you have a battery, any battery will lower the resistance of the body or will weaken it. And I can show that on anybody, even with a battery-operated watch. So when you have a crown on this side and a filling on that side, and perhaps a partial denture with a metal connector in between, you have a scrambling of the acupuncture meridians right across the midline, just like with an electrical wire or battery.
So you're just going to the dentist to get some work done, and you're completely unaware of what is going to be the long-term damage to yourself from that. And that is a scary thing.
It is scary because dentistry does not, it's taught, but it's not made very clear as to what the body, what parts of the body are being affected. For instance, a root canal can and does cause cancer. I have not seen one case of breast cancer that did not have a root canal, an infected tooth, or a toxically filled tooth on that meridian, on that side, in the 35 years I've been aware of it.
And that in itself is the scariest thing ever.
Yes. And when you have thermography for breast cancer, quite often you can see the red line going straight from that tooth all the way to that cancer. This was proven in the 20s by Weston Price and proven again and again by scientists. But belief systems, unfortunately, are at work here.
There's a lot more at work here than just belief systems. Anyways, we have to head to a Zen break. We'll be right back.
Hi everyone, my name's Tree. I'm a certified yoga instructor as well as a hypnotist and an NLP practitioner. I'm here today to talk about movement and your body. It is so extremely important to move your body every single day. It surprises me as a yoga instructor that people come to class just once a week and they don't walk or do anything. And they wonder why their hip starts getting sore or their knees start getting sore. So get out there, go for a 20-minute walk at least every single day and just move your body. You will be surprised how amazing your body will feel, even your thought process. It does so many great things. Just move your body, especially if you're working at a desk. Get up, just shake your body all around if you need to. If you have any questions, contact me at tree@healthlocal.ca or just go to healthlocal.ca for anything that's health related. Thanks for watching.
Welcome back. I hope you enjoyed the Zen break. Dr. Oksana, you're giving us some great information today, and it's funny because I've had some clients that come in and they're very depressed or they're having issues with their body, and I find myself now asking them the question of what's in your fillings and how are your teeth? Because to me, it's like if they if they tell me they've got this kind here and that kind there, and I'm like, you need to make an appointment with your dentist and get them removed.
One of the issues is that, for instance, kids have braces. Braces are made of nickel.
Right.
Nickel is known to cause depression. And we wonder why we have teenage suicides, especially in girls. So many kids are on antidepressants, but we don't look in their mouths. They will have the braces, they might have a filling or two, and they might have a tongue ring.
Oh yeah, they get their tongues done, and yeah.
And a tongue ring is very, very damaging because not only does it go through the meridians in the tongue, but it also keeps leaching nickel all the time. I had one girl who, within 3 months of having her tongue pierced, went into chronic fatigue and depression. And it took almost 3 years of detox to get her back.
That's amazing and scary. And I really want everybody to watch this video, like, because it's so much information that will relate to so many people. I mean, I could just see, like, I'm just thinking about my mother who's had a root canal. I'm thinking about my sister who's had all of her teeth veneered.
Veneers are not bad if they are done without cutting the teeth down.
Which they did.
Okay. Cutting teeth down for anything, I think, is a sin. I'd rather have them straightened, and you can veneer teeth by just applying veneers that are very, very thin right over the top of them. And I did those for my daughter. They do not ruin the teeth. They can be taken off, and the teeth are still fine. But veneering by cutting the tooth down, I think, is a sin.
And what about those people who they get the metal implant, like those implanted teeth?
Yeah, implants are a very elegant way of replacing teeth, and they do maintain the bone, but unfortunately they're metal, so they block the meridian that they're placed on. So if somebody really needs an implant because that's going to sustain their bite the best, because the bite is also very important as part of structure, then I recommend non-metallic implants. And dentists who don't place them will say, oh, they don't last as long, they don't have a good history. They have a 30-year history in Europe. So just because they haven't been used here for the last 30 years doesn't mean that they haven't been proven.
Right. Those Europeans, they know a lot. Okay, so when you're preparing for pregnancy?
For pregnancy, many people now are starting to be aware. I want to be sure that I have a healthy child, that I don't have an autistic child, that I don't have a Down syndrome child, et cetera, et cetera. And I tell them the best way you can prepare is by detoxing yourself. I find that many people are toxic. Right now, they have done studies that show that the average female is 50% more mercury in her body than a generation ago. And this is not just from eating fish. It is because the toxic load from the mother has come down. If the person that is being investigated or treated is a firstborn, they will detox the mother the most. A firstborn tends to get the bolus of mother's toxicity.
See, that explains everything in my life then.
And then vaccinations have thimerosal in them. If you wore contact lenses in the 60s and 70s, you would have had thimerosal in your lens solution. There is mercurochrome that was used instead of iodine on cuts. That's mercury.
It's almost maddening. It's maddening that we go to... I always think that everything, like, I don't ever want to bash conventional methods, but I always want, I feel that everything has its place.
Yes.
And I always say, like, if I was to all of a sudden have a heart attack here, I'm not going to be like, oh my God, bring me the frankincense. Like,
That's right.
They're going to come and they're going to take care of me, and I'm going to have to deal with the medications they're giving me and detox myself afterwards. But it's just, you go to your doctor or you go to your dentist, and you're going there for your health, and they're poisoning us.
I encourage people to not just question their health practitioners, especially the allopathic ones, but also question every procedure. And if you don't get the answers that you really think are well based in science, then go and ask somebody. The internet has been a real boon for information. Of course, you also have the wrong information there as well as the right information. Right. You have websites like Quack Watchers who bash everything that is alternative in every way possible. And so they do a lot of damage. But Quackbusters is supposed to bust quacks. Do you know where quacks comes from?
No, that was just a term that I knew that was for bad doctors.
Well, quack was Quicksilberarzt in Germany, which meant the doctor that injected mercury for infections.
Oh.
Those were the quacks.
Oh. I don't know. I feel like we should all be working together. I don't know. I must be living in a world of fantasy because I just don't understand what we're doing to each other.
Yes, the pharmaceutical world has taken over to the point where doctors are not allowed to use nutrition or supplements or other alternative methods to treat their patients.
But that's only here. That's not in Europe.
No, that's here. But in Europe, they also have something called Codex Alimentarius, which limits, for instance, the amount of vitamin C you can get over the counter to 80 milligrams. You have to go to your doctor to get a prescription for a stronger vitamin C. You should be getting 1,000 to 3,000 a day. You will get synthetic only if by prescription. So that's Big Pharma with its arms over in Europe.
I could talk to you all day and then just want to detox like mad afterwards. And I just, like I said, like just even changing my toothpaste made a huge difference with my mood and everything. And, my dentist calls now saying, you're overdue for your cleaning. And I'm like, I'm not coming.
Good for you.
And the good thing is, like, how sometimes when you get that plaque built up behind your teeth and you can feel it, and then after they do the cleaning, you can feel every ridge sort of between your teeth. And I'm finding that's happening with the toothpaste that I'm using, that I've made for myself. So I don't need to go in to have them to do it. I'm doing it on my own. So there are ways. So I know that you're moving into the mini mansions and you're doing some work there. But my question to you is, are you teaching others?
I teach a course called Predictable Periodontal Outcomes. And it is for dentists, hygienists, and I also do teach one of these courses to non-dental personnel like naturopaths and other practitioners, how to recognize what the problems might be, whether these problems might be affecting the rest of the body or not, and also where to refer. Because if they refer the patient back to their dentist and the dentist doesn't have a microscope, then how can that dentist tell them what infection they have? So
true.
That's the kind of courses that I teach, and I'll be teaching them at many mansions.
And I think that it's confusing, too, for the person who's coming, the patient.
Yes.
Right? Because they're getting one piece of information from someone like yourself, and then they go to their dentist and they go, I heard blah, 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 and they're going to be like, don't even worry about it. That's just a bunch of garbage, and just do what I tell you.
That's right.
And the person who's sitting there going, I don't know what to do now.
This is why I think that people come to me, because they say, at least all this information that I have, can you please explain to me why I have this opposite to this and opposite to this? And so I can help them go through that maze of information, whether it's from the internet or from their providers, and tell them, this is the most holistic route. This is going to do this to your body, and this is going to do this to your tooth. And because I'm positioned very uniquely with a whole body approach, but also a dental background, I can look at an x-ray and say, you've got an infection in there. And until you get rid of it, you're not going to get rid of your chronic illness or of your cancer or of whatever.
Well, I know that the only thing that's running through my mind is right now is that the first thing I'm going to do is I'm going to change my intake form for clients coming in to see me and ask them what they have going on in their mouth.
If they know.
You know, do you have fillings? Do you have this? Have you had braces? I mean, I think this is questions that we need to ask.
Yes, very much so.
I don't know what to do with it, but at least I know that I can then refer them and be like, okay, so I have this issue with this client, and maybe it's because of all of this. So, okay, thank you for coming out.
Thank you for having me.
Do you have a promotion?
Yes. Anybody that would like to check out their mouth with a microscopic plaque analysis, if they say that they heard me on this program, they get 50% off the price.
Nice. Thank you so much for coming out. I'm really, you offer such amazing information, and useful for everyone. So it's great, and thank you for coming here and spending the time and learning. And I know you're probably all holding on to your mouths right now. So thanks for coming out. Please contact me with any questions, any comments, anything that you want to know about. That's why I'm here. So I look forward to hearing from you. You can see us on YouTube and Vimeo. And have a great day.